can see this press release that we got up. President's budget, extending Medicare solvency by 25 years or more, strengthening Medicare, and lowering healthcare costs. There's three major features of this. The biggest one is, which, will extend it at least 25 years. And that would be to increase the Medicare tax rate on people who are earning $400,000 or more. Now, again, we have progressive taxation in this country. And so let me be explicit with this. I mean, I don't really even care if it was raised for people under $400,000, but or applied to the first $400,000, but it's not. If you make more than $400,000, any dollar made above $400,000, there'll be an increase in your taxes by 1.2%. Whoa. So if you make $500,000, you get taxed like everybody at 3.8%, or at least above a certain threshold, 3.8% on the first 400,000, and then on that next 100,000 you make, hold on to your hat, it's going to be $1,200.
Wow.
That's going to hit you hard in the pocket.
So you probably create less jobs,
You're going to probably go out and create less jobs for like your, there's going to be, I don't know, that sounds like basically a couple hours less babysitter time that you're going to get. I mean, I don't know what people are paying for babysitter. I'm paying like $20-25 an hour.
And lots of less innovation that we won't be able to even calculate.
That's right. So all those fur sinks that would have been shipped, those aren't going to happen. So this is like an incredibly moderate increase to our taxes, and won't hit the vast majority of Americans. I don't know. $400,000, I think, puts you in like the top 5 percentile of earners, maybe even higher, or I should say lower. And this is a very moderate increase, but will save Medicare until, well, I'll be gone.
2050, at least, they said.
Well, I won't necessarily be.
No, you'll still be.
No, I'll still be around. No, I'm lasting until like 2070, I think was my plan.
Yeah.
But we'll see.
That's because that Medicare will be still
exactly.
kicking in.
So that's important. And there is other things that, I mean, a little more loopholes existing in Medicare taxes, essentially, so that it's harder for high-income people to shield themselves from that 3.8% of Medicare. I just can't believe people do that. I honestly can't believe.
What, be smart? Their money? It's called finances. Look it up.
There's a way of doing it, apparently, where business owners somehow ensure that their income is neither earned nor considered investment capital gains. I don't know how that happens. But the budget would ensure that the Medicare taxes apply to incomes over $400,000 a year without the loopholes. It will also credit savings from prescription drug reforms to the HI trust fund. That's the Medicare fund. And essentially making sure that any savings that came from the Inflation Reduction Act on price negotiations will be dedicated to shoring up health insurance funds. It will also lower out-of-pocket costs for drugs subject to negotiation. $2 cost sharing for generic drugs on chronic conditions. More basically Medicare stuff, drug prices going down. And also you get 3, I guess, there will be no cost sharing for 3 mental health or other behavioral health visits per year.
And they calculate that into the drug prices kind of going down into the savings for Medicare as well.
Yep. And so good stuff, not necessarily anything that's going to pass per se, but The point is to educate people and to make it clear when Republicans start saying we need to cut Medicare, we need to raise the age of retirement for Medicare so that people aren't eligible to it. Understand what they're doing is we need to put the onus on individuals and force them to work longer so that they can get health care. And that has the added benefit from the perspective of the capitalist class that like you have more old people in the job force. Mm-hmm. That means there's going to be less pressure on wages because there's going to be more people competing for the same amount of jobs. And understand, this makes it clear there is a very easy fix for Medicare. Very easy fix. $1,200 extra if you make $500,000 a year. If you make $600,000 a year, $2,400 extra. If you make $700,000, I can keep doing this because the math is super simple. $3,600. $700,000 a year, and you're going to be worried about $3,600. If you're making $700,000 a year, you're having dinner at least once or twice a year. That's going to cost you $1,200. I don't know about that, but maybe. So very reasonable, and understand like the implications of these small changes, which seem small, and they are. I mean, let's be clear, they're small. They're small. But you're talking about the difference between providing health care for millions upon millions of Americans for 2 or 3 years when they can retire earlier. And how many years do you have left at age 62? If you're making in the bottom 50% of the income distribution, actuarially speaking, not many. And why shouldn't those years be more enjoyable? Like, what's the point of society if you cannot enjoy your life more at the end of your life?
Well, for the people pushing against it, it's to make them more money.
Exactly. David Dayen has an interesting piece. Again, small bore stuff, but it impacts and it mitigates sort of suffering and difficulty for millions upon people. Millions upon people. And we also have an example of the absolute opposite that you'll talk about in a second, Emma. But 4 major pieces of legislation passed during the Biden administration. Probably no more major legislation. The bipartisan infrastructure law, CHIPS, which was the semiconductor industrial policy stuff. The Inflation Reduction Act, also more essentially industrial policy stuff. All good to some varying degree, some better than others. On balance, good. There was also the $1.9 trillion American Rescue Plan. There was a lot of great stuff in there, stuff that reduced child poverty by upwards like 1/3 to 40%. Stuff that essentially we have let as a country expire.